Hi, welcome to Social Psych. Happy lecture time. So, up to this point in class, we've been talking about a lot of constructs, right? We've talked about biases, heuristics, attitudes, cognitive dissonance. So, now we're getting more into the applied segments of the class where we take these these constructs and we make sense of them in very applied, socially constructed concepts like culture, race, ethnicity, gender. So we're going to start, going on a different path in this class and thinking about the constructs that we've learned and how they apply in the world we have constructed. So today we're going to do an intro to culture as our place to start. And I want to share that in lecture today, and I guess moving forward too, I would like for you to keep in mind that as the professor of this course, I'm going to be sharing how I've made sense of a lot of this. So, a lot of the sources I've pulled based on what has resonated with me in my own development and conceptualization of, who I am and how I digest and make sense of the world we live in. So, my hope is not that you feel you have to that everything I say is fact, but I would like for you to critically think about my thoughts and see how it resonates for you and how you're making sense of things. And I'm excited to hear from you what your thoughts are on these topics. All right. So, as we begin, I'm going to start us off with a really meaningful metaphor. I think it's a meaningful metaphor. I heard it from my colleague and friend, Dr. Kendria Hart. So I can't take the credit for it. But if you want, close your eyes. I know we're getting a little cheesy. Close your eyes and rest in your chair wherever you're sitting. We're going to go on a little journey. So you're walking down a forest trail. And all around you, you see trees with beautiful long branches and leaves, each one different from the next. You can see the dew of the rain that's fallen on them, and you see little trickles of raindrops reach the ground. It's pebbles, and then you see the different plants coming up at different heights. You can't tell which one is the next one because they're all so different and vibrant, different shades of green and brown, and you can just smell the freshness in the air with little scents changing along the way. Then you start seeing some flowers popping up, and you keep walking, each flower different from the next. And that's your first imagery of forest walking. Now we're going to go into a second forest. Take a breath. Here we go. We're going into, keep your eyes closed. We're going into a second forest right now. This one's different. The ground is really smoothly paved. You're looking at all the trees, each one the exact same height, the exact same shape, every leaf exactly the same, and the exact same placement on each tree. The same drops of dew on the leaves, but it gets repetitive. You see it over and over and over again. The bushes are neatly trimmed in exactly the same shape, same leaves, same flowers, all the same height. Open your eyes. Okay, so which forest would you rather be walking through? I'll say that when I think about this metaphor of having this beautiful, unpredictable forest, I think of how this relates to culture in America, right? The idea that we can really appreciate the beauty of difference if we let ourselves. But unfortunately, we've fallen into this trap of valuing predictability, of feeling safe and controlled by knowing what's the norm and what is, the consistent, acceptable path that we should be taking, where anything that's different is accompanied by this feeling of fear. So, not to say if you chose forest number two, that's awesome. And we see how that safeness kind of resembles this world that we've socially constructed in America and possibly even around the world. We're forced one, what if we gave ourselves permission to really let everybody's individuality shine, and where each person's factors that makes them so unique is something we celebrate rather than fear? So this metaphor just serves to, I hope you enjoyed your guided imagery. And also, I hope it gets us thinking about how we really are living in a socially constructed world. And just as easily as we were able to construct it over thousands of years, the question rises, can we deconstruct and reconstruct, where we can one day work toward really valuing and appreciating everybody's individuality? So with that, I'm going to share my screen and let's get started. Okay, so here are some questions if you want to sit and think about them for yourself on what's culture, what is it not? What do you think of when you think of culture? Positive connotations, negative connotations. What does privilege mean to you? I think these are words that, you know, we've all heard about. What is cultural humility versus cultural competence? What's call in or cancel culture or call out? What do you like about it? What do you dislike about it? And I think something that we can think about, as especially as we think about, you know, the internalized fear, right? Or the power structures that we have in place that just inherently have us ingest biases, and that we integrate into our thoughts, that could cause us to sometimes make attributions about other people of other people being bad, malintended, scary. So that being said, I'm curious how the quote by Anne Frank resonates with you. The idea of, I keep my ideals because in spite of everything, I still believe that people are really good at heart. Okay. So conversation starters to get, you know, everybody thinking. So where do we start? I just have talked about the idea of us living in a socially constructed society. So what this means from a constructivist perspective is we have literally created a narrative around who's in power, who is the dominant culture, who are people who are we considered part of the oppressed culture or marginalized culture, who have to work even harder to achieve what the culture in power has. So we're going to talk about the idea of constructivists, how we build a narrative and how we attach meaning to different things. And then critical theory, we're talking about culture from a critical theory perspective to really make sense of how this power dynamic kind of helps us make sense of the world we're living in. All right, so let's start off with some terminology. So we're talking about systemic power versus institutionalized power. So very similar words, they're very nuanced in how they differentiate. So systemic power is the idea of collective practices and representations that advantage categories of human beings on the basis of their perceived culture. And I should say socially constructed categories. We make groups out of, you know, people who are just, we're all part of the human race, and yet we have socially constructed categories that empower some and disempower others. So systemic power is not referring to individual biases, but to the power structures that have ingrained the biases as attitudes, heuristics that we must undo. So it's not the biases themselves, but it's how we have come to just accept things. So for instance, when we look at Harvard University, the first class was all white men who got in based on the Binet, right? The Stanford Binet intelligence test at the time, schools were segregated at this time. So it was built to empower a specific demographic of socially constructed demographics to then continue being the cream of the crop in our world. So, and then the idea of in-group, out-group, all of these ideas are indoctrinated into our thoughts. And in order to detach from them, we have to resist and actively reflect and engage in reflection because we just consume it by living in the world we live in. So then let's look at institutionalized power. So this more specifically are racist ideas and practices that we put in place to differentiate and segregate and give power versus take away power. So these are things like laws, policies, resources, access to resources. So when we think of like, oh, well, there's like, I'm not racist. There's like only like certain people are racist. Or there's incidents of racism and other times we're not racist. No, there's no such thing. So in order for us, like I just said, sorry, I'm repeating myself, but in order for us to consciously not, well, the idea is nobody is inherently not racist, right? Because in order to be not racist, you have to constantly be pushing against the norms of what has kind of been given to us to digest. We have to constantly be pushing against the norms that are guiding the culture and world that we live in. So institutionalized power is the idea of racist practices that maintain the status quo to empower some and disempower many. All right, so not lastly, but the term white supremacy when we think of power dynamics. So white supremacy is a form of social, fiscal, and legal control designed to give power to particular people by perpetuating hatred and conflict among members of the empowered population. So this refers to the idea that where white supremacy, we've been empowering, a particular group that we'll talk about on an upcoming page to be in power so that they have access to resources that are socially vested, fiscally vested, and legally. So when we talk a lot about disproportionality and we see overrepresentation of minorities in prison systems or overrepresentation of minorities being in the lower socioeconomic status brackets compared to the upper socioeconomic status brackets, this is ongoing perpetuation of white supremacy. So it's the whole idea of resources that the empowered people in our culture are maintaining resources and want access to the resources, as we all want resources. But there isn't enough to go around for everyone. So it's about making sure there's enough up here and less down, and saying, well, once we're all satisfied, we can, let the rest of the resources go to those who are not in the position of power. Okay. So as far as how we construct power, so in America, particularly, we have a constructed power group dynamic, and this is how it's discussed in literature. And we also see it as historically, who is captured in our history books. Two acronyms that are used are WASP, White Anglo-Saxon Protestant, and WEIRD. So funny, isn't it? Western educated and from industrialized, rich, and democratic countries. Cultures. So these are like when we think of who is the empowered, group of people in our American culture, these are acronyms that come to mind and that have been demonstrated historically as maintaining that power structure. So when we think of culture and how that fits in, ask yourself right now, like how do you identify as an individual? I, for myself, would probably say I am a Jewish female, and I'm a dog sister. So like these are salient identities to me. So when I think of, so when we talk about culture and power, the idea of when we think of our identities, the words that come to mind are typically ones that we associate with culture, right? So when I think of Jewish, there's like a rich cultural factor there. And then female, there's some level of oppression there, right? So it's not, and then there's like cultural, things that bond females in particular, such as getting access to voting rights. And there's, shared norms and groups for women. So So when we think of our cultural backgrounds and what makes us different from that, dominant normed culture, the empowered culture, that's when we tend to really make sense of the culture in our own lives. What's interesting is the factors, for instance, my white identity. I don't necessarily think of that as having a culture necessarily. And so it almost feels like the absence of culture because it's just kind of part of the norm and expectation, right? So like if I'm in a river, I'm going with the current. But then factors like my female identity and my Jewish identity, I think of a lot of rich cultural experiences. So this is just interesting. The idea that without really thinking about our culture when we're part of a normed culture, it can almost feel like the absence of. And so it's a lot about searching and understanding who we are in these different contexts. Um, all right. So then we think of the culture of the oppressed, which is when people have identity components that differ from that culture and power. And this is socially created to enable power, resource distribution, and structure. So that's like my Jewish female identity that I was just sharing about. And so when we think of power as fact, right? Like we say in our society that white upper class men tend to be the empowered individuals, and we almost accept this as factual, like how like it's not a opinion piece. Like when we look at our demographics of where socioeconomic status, upper who composes that upper socioeconomic status, who has resources, who's living in wealthy zip codes, we can see that is predominantly composed of the empowered group. So when we think of power as fact, right? Then how do we undo these structures? These are things to think about. And I think a lot of you are tackling this with your social psych projects. So things to think about. And you can also think about how we can answer this based on our previous class concepts of biases, attitudes, creating cognitive dissonance for people. So interesting thing. Okay, so now that we've been talking about culture, let's actually dig into what the definition is. So culture is socially shared beliefs, values, norms, expectations, and practices within a group, community, or society at large. So culture includes an unspoken set of rules of conduct within a group, such as acceptable social standards. So like it's interesting for myself, like in my own culture group of being Jewish, for instance, when I walk into synagogue, there's certain practices that we do. We put on a tallis, we put on a yarmulke. And then like at certain holidays you say things like good yontif, right? So it's not necessarily things that people outside the culture would be familiar with, but when you're part of a culture, there's a shared unspoken experience that you get to connect with others over. So all of it's again socially constructed, right? So the people in my not in my synagogue, but Jews for many ages have been engaging in these practices, and it's carried on where it's just become indoctrinated into the culture that this is what you do. So maybe think about your own cultures and what kind of cultural habits you're in that you wouldn't even think twice about, but they've been kind of ingrained into who you are as a person. It's fascinating to think about that. All right, so then when we further think about culture groups as socially constructed, so it's not like there's biological factors to each of the culture groups that we've created, right? So, for instance, race ethnicity, when we see this on a census where many people will have to circle African American when many people who identify as a person of color or Black are not, necessarily from Africa. So it's a socially constructed concept that may not be accurate, right? Then we think of gender. Yes, when we think of sex, there are factors like for people born female, they're likely to have a period at puberty, right? Or, men are likely to have penises. Like, sorry, the words that are all I can't say, but there you go. Like, these are things that happen, right? They're biological components. However, the idea of our gender, how we make sense of who we are, we've constructed this binary concept of male and female, of man and woman, when really, who says we have to have these labels? To make sense of not necessarily subscribing to one or the other, we have terms now like non-binary, transgender for people who are born, one sex, who are told you're one gender, one sex, but identify and feel as if they're the other, right? And like that's who they inherently are. And so we have these different constructs of what gender can be, and the fact that gender in and of itself is a construct is socially constructed, right? But we feel the need as a society, given our attitudes, given our beliefs, that we need to have words to give as schemas to make sense of groups as wholes. So gender is one where labels may not be effective at conveying entire thoughts of self around one's gender identity, but we use terms to help make sense of it in ways that feel authentic to people. And socioeconomic status, for instance. Who decides what the cutoff is with being, an upper class socioeconomic status individual? It's statistics of like the upper 1%, 10%. So these are all socially constructed, and how, delegating, who is in the upper versus lower is also a socially constructed systemic power process. So when we think of culture groups, furthermore, additional examples, when we think of like having connectedness with others and shared experiences, teachers are a culture group, right? Experiencing high burnout, likely loving working with kids. Vegans are a culture group, sharing similar recipes or ideas. Being parts of unions, religion, Western versus Eastern culture. Trump supporters as a culture where, there's a shared value sense among, people in this particular group, right? Individuals with disabilities in advocating for similar accessibility rights. English as a second language learners and immigrant families. So these are examples of cultural groups. It's not just, like what we typically think of as race or ethnicity, which that is absolutely a cultural group, and culture expands to be so many different things. Okay, so then when we think about culture, as we just discussed, being a part of different cultures plays into the systemic inequities, and having disproportionate allocation of resources based on which culture you subscribe or identify with. All right, so for instance, when we think of mental health care utilization, so minorities are underrepresented typically in mental health and mental health care systems. So, for instance, many minorities have endorsed, rightfully so, a lack of trust in providers or agencies providing services. So, first of all, there's a lot of malpractice suits with by people of color who have been given incorrect diagnoses, who are not getting the adequate care needed, who are over diagnosed as being at risk or having problems in systems. And so when there are these experiences of being treated poorly, it makes sense that people are not wanting to access the healthcare that's supposed to help people get better, but really can at times do harm. So we see disproportionate ability to both access healthcare and get the help that's needed from it. Furthermore, it's too costly. When we think of minorities, particularly lower socioeconomic status individuals who may not have access to the greatest healthcare, it can be way expensive. And so when we think of who has insurance, 25% of Latinx individuals are insured, while 50% of white individuals are insured. So let's change this. Thank you. Sorry about that. So then there's a higher mortality rate of minorities compared to white America. And we look at this related to both access to fresh, healthy vegetables with that, higher socioeconomic status paycheck, but also, access to healthcare that is less of a stigmatizing experience. Then minorities are more likely to rely on visits to an emergency room rather than to private physicians. So these are things, what I would recommend if this is a topic that really interests you, I would consult this source that's in the references on this PowerPoint. It talks about like rationales and why this is happening, but a lot of this has to do with this cyclical, the idea of medical providers having biases of not giving the practices that they would to someone that they have less biases toward. And then when people have this negative experience, it leads towards a distrust of providers and a lack of willingness to go and wanting to really, go to places as a last resort, like emergency rooms, rather than seeking out private physicians, which are just too costly. So this is an example of how people are impacted systemically in the healthcare system, which literally leads to higher mortality rates among minorities. So let's also look at mental health. So there's the idea of validity in disorders, right? So validity meaning, do these mean the same thing? Do we make sense of these disorders in the same way? So ones that have high validity across cultures, so where we do see like them as having the same representations across cultures, are mental health disorders such as schizophrenia, bipolar disorder, panic disorder, obsessive compulsive disorder. So these are some that across cultures look very similarly, and we are able to say that is schizophrenia, okay? But there are disorders that are low in validity that present differently and that we may differentially diagnose, such as depression. So part of the reason for that is we experience and present depression differently. And especially if you're in America where, depression, where we think of depression as looking a certain sort of way, but then you have people from, various cultures who are discussing their experience of depression differently, it may get misdiagnosed or seen as something different. So an example of cultural differences with mental health is idioms of distress. So this is the idea of an illness language, where that's associated with particular culture groups, where people have a particular way of expressing their experience of an illness. So for instance, some culture groups talk about somatization, which is the expression of distress through somatic complaints. So like if I'm feeling anxious or if I'm feeling depressed, I may talk about, some cultures may talk about like, oh, my stomach is really queasy, or like, oh, I have such a headache. This is somatization. It's the presentation of feelings of pain, of discomfort, in place of being able to really also reflect on how that's manifesting emotionally. So even though this is a valid representation of depression, it's talked about differently than how we would want to diagnose it based on our typical understanding. Then there's the idea of culture bound syndromes. This is where we socially construct norms that lead for certain behaviors to present as problematic or as disorderly. So, for instance, in America, even in Europe, with heavy focus around thinness, we have this disorder. The disorder of anorexia nervosa is heavily prevalent in America because of the cultural expectations that we have around it. Where in other countries, where being more, what's a good term? More luscious. There we go. Having more fat on your body is seen as a sign of health. So this anorexia nervosa is very socially constructed, and in America we see it as being pretty prevalent. Also, gender dysphoria. In America in particular, we have socially constructed the idea that gender is binary, male, female, or man, woman. So then gender dysphoria is this idea of somebody doesn't subscribe to that cisgender gender identification of I was born female and I continue to identify as female, then there's likely a lot of stress surrounding this experience because their culture tells us like cisgender is what you're supposed to be, right? These are like the expectations that come our way. We have what's it called? We have baby or what is it? Gender reveal parties now. We place and then like rooms are painted pink or blue accordingly. So we dictate to ourselves the importance of gender and how factually based it is in who we are as people, that when someone comes to, be self-reflective and say, oh my gosh, I think I'm non-binary, or oh my gosh, I'm transgender, there's this stress that likely gets associated with it that is above and beyond a typical stressor one would experience. So this is part of that social construction and value of that binary gender, and the fear or stress that comes out of someone having to realize they fall out of this constructed worldview. All right, so then when we think of cultures with disproportionality, and also how that really relates to therapeutic experiences, right? Because we're therapists in some regard, mostly. Okay, so when we think of correlates, people from lower socioeconomic statuses are correlated with higher rates of mental illness and psychological distress. So for instance, people who are in the lower socioeconomic status brackets are 2 to 3 times more likely to have a psychological disability than those from higher socioeconomic status backgrounds. Also, as far as an like socioeconomic status as being an indicator of diagnosis, this is so fascinating that when individuals went to a hospital, this is from a study, GARB 97, people from upper socioeconomic status and lower socioeconomic status went to get diagnosed for a mental health concern. Presented with identical symptoms. The only difference was their socioeconomic status indicators. The person from a high socioeconomic status background was diagnosed with schizophrenia, this is supposed to be low. So people from a low socioeconomic status were diagnosed with schizophrenia, where people from a high socioeconomic status were diagnosed with bipolar. So it's different. It's interesting how the same symptoms can present as two different diagnoses based on assumptions and biases and attitudes around socioeconomic status. All right. Lastly, people who are from a lower socioeconomic status background and lower education attainment, so like a high school diploma, college degree, tend to be more likely to drop out from therapy, and are also likely to receive services from people with less training. I'll tell you, when I was in my postdoc in Astor in New York, I was getting paid peanuts, right? Because you're an intern for the most part. And you're working with people who are, we were working with people on Medicaid. And it was really interesting because it was basically a pump out. Like anybody could come get services who was on Medicaid, but everybody who was providing services was interns who were learning how to do therapy. So, sure, I was trying my best, but at that time I was still developing my skills, and I'm continuing to develop my skills. But this is just an example of how systems are set up, where people with less therapeutic skills are treating people where there is the most prevalent need. Given this finding that there's more likely to be psychological distress and disability presence. All right. Also, just fun facts, like why do we think there are these stressors, more need for therapeutic services? Because of the lack of available resources, right? On top of whatever individual needs we have, based on our own lived experience and our own biological makeup. For people from lower socioeconomic status backgrounds, there's additional stressors of how am I going to make ends meet? How am I going to get my debt paid off? How can I keep this roof over my head? So when we have these stressors, it's kind of like minority stress theory, right? It's additional stressors above and beyond that make people more inclined to experience mental health distress, because there is not that basic, Maslow hierarchy of needs, those basic skills are not necessarily met when there's a lack of resources. Okay, so then let's get into the idea of disproportionality among refugee and immigration populations and individuals. So with refugees and people who are immigrants, there are higher rates of psychiatric hospitalizations in the US, especially among young men. Makes sense. Frontal lobe, development. It's when people are younger, it's harder to process through things as much as someone with a more developed frontal lobe. And then when we think of, which we're going to talk about gender a lot more in a few weeks, but we think about the social construction of ability to express emotionality, men are it's less socially acceptable for men to express their emotions, right? Which not being able to express one's emotions paired with the stressors of having to come into a new country and learn new ideals, paired with stressors of having to acclimate and frontal lobe lack of full development, this is going to make sense. All right, so given that there are stressors related to varying acculturation rates within the family, it's important to know that children are more elastic in their ability to acclimate and accept the idea of it being okay to need to change or amend their ways. Also, there's a peak of psychiatric problems that we see at about the 1 to 3 years following immigration, right? Because there's the first initial exposure of like shock to a new culture and getting acclimated. And then at the 1 to 3 year point is that acceptance around where am I struggling? What is not, making sense? How am I not fitting in? So we see, and that's just one example. There's so many more examples of and like job acquisition, right? How am I going to, care for my family? So there's a lot of peak psychiatric problems that we see arise for people who are refugees and people who are immigrants from 1 to 3 years from immigrating. All right, so in thinking about what we've been talking about and in thinking about our past constructs that we've discussed, I'd like for you to take a moment to reflect on the refugee internment camps that our nation created a few years ago. So how would you make sense of these with everything we've discussed with regard to the marginalized experience that refugees may take on? So just like in thinking about the power dynamics, the systemic and institutionalized power. So thinking about all of this is like a recent event that we can make sense of these constructs with. Okay, so take a little break and then we'll come back. Okay, so let's talk about acculturation. We tend to think about acculturation when we think about people who are refugees or people who are immigrants, when there's a culture that someone is extremely familiar, that almost serves as a primary culture source, and is then acclimating and getting familiar with a host culture, a new culture that's presenting as one to learn about and to decide how am I going to integrate this into my sense of self out of having recently moved. Okay, so there's a few terms to think about with acculturation. First is enculturation. This is the process where we learn our own culture. So this is greatly influenced by our home settings and our families. But then when we think of acculturation, like we just talked about, it's the process by which members of one cultural group learn about and adopt the beliefs and behaviors of another group. So for instance, if we're thinking about people immigrating or coming to America as refugees, coming from a country where there may have recently been trauma and seeking, safety and security in the United States, for instance, it doesn't always look so, beautiful, and it's not always so safe. But it's the idea of learning American culture so one can learn where do I fit in? Biculturalism is then where we integrate both aspects of that home culture and the host culture to make that sense of who I am when accounting for both of these. So it's learning where and how we're going to integrate. All right, so then there's two key factors that we need to consider in the acculturation process. First is cultural maintenance. This is our sense of self and thinking about what sense of cultural value is going to play a role in our lives. Is it like what role and how much integration am I doing of my own culture and my host culture? Next is contact and participation. So this is engaging, the engagement with the dominant culture or other cultural groups. So if someone is a refugee coming to America, it's about engaging with Americans at a grocery store, at work, in a school setting, and learning from those experiences about what sense they're going to make of their own lived experience and their biculturalism. Okay, so when we think about what happens as a result of cultural maintenance and contact and participation, there's four different outcomes that we could see. So one is assimilation, where individuals abandon their cultural identity and they seek regular interaction with people from the dominant or other cultures. This can look like language preferences, adopting dominant attitudes, membership with dominant social groups. So it's really acclimating to the host culture or to another subculture in the new place that someone is living. Separation refers to when individuals place value on the original culture and wish to avoid interacting with people from other cultures. I really loved seeing this in Washington Heights when I worked there in not upstate, in Manhattan. It's a predominantly Dominican culture, and a lot of people don't speak English. There are fruit stands with imported fruits directly from Dominican Republic, and people are like, there's panaderias, and the streets look like I don't know. I haven't gone to downtown Dominican Republic, but it looks like its own world compared to like if you were to go to Midtown where there's like, the Broadway lights and, the Disney store. So separation is the idea of not engaging with the dominant culture at all and really holding on to to one's own culture, the primary culture, and separating from that dominant culture. So that was just an example that I saw that really spoke to me about an example of separation. Integration. This is where people maintain their original identity when interacting with people from other cultures. So this is when people are able to interact and engage with the host culture or other cultures, but also stay true to themselves and who they are and who they bring to the table, or what they bring to the table with their, sense of self from their home country and their primary identity. Then there's the idea of marginalization, and this is where people don't maintain their cultural identity and don't seek to interact with people from other communities. So this is where there's almost an absence of culture, not really finding an affinity or a belongingness in one's home culture, and not finding connection or belongingness with the host culture. So ideally, we're going to see, integration is where there's, being able to integrate both. And really the only harmful one is marginalization, where there's kind of a sense, like a lost sense of self. And so assimilation, separation, and integration, assuming that people are, satisfied with these strategies, there's, these are absolutely acceptable in ways that people can, make sense of their host culture and different cultures and their own culture prior to moving. All right, so this is a really interesting study by Borges in 1997. It's an interactive acculturation model. So what it shows, and feel free to read it, it shows how a community of the host community, so meaning like dominant American communities, like the dominant culture, how that culture interacts with communities of immigrant communities. So what it's showing right here is when people from the host culture demonstrate a sense of being willing to integrate, assimilate, segregate, exclude, or individualism. So these interact with an immigrant community's likeliness to experience integration, assimilation, separation, enemy, and individualism in these ways. So for instance, if both parties are willing to integrate and, honor both sense of the host culture and home culture, that tends to be consensual and that tends to lead toward like a happy experience. However, it can be a problem if the host community, right, of dominant culture and wants to engage in assimilation, like if they're wanting people to assimilate toward the dominant culture, but the immigrant community is wanting integration, wanting both. So this looks like the host community saying, no, we only want you to consume and be members of our culture. But the immigrant community is saying, sorry, we like both. We're going to do both. So what's the problem? So that's why it's problematic. So then the idea of conflictual, where there's segregation, the host family says, no, we don't want anything to do with immigrant communities. And yet the immigrant community is looking to integrate, to have both. That's conflictual, directly conflicting with each other's ideals. And so this is how this reads. You can map out and play out different situations to see how host culture and immigrant community cultures, when they interact, whether it's consensual, problematic, or conflictual. So it's a really cool article. I hope you like it. So how does acculturation relate to stress and depression? So in a study by Jabrigagas, I don't know how to pronounce that name, but it's a really important study, a valuable study where 506 international students volunteered to answer questions about acculturation, stress, and depressive symptoms. And what was most frequently endorsed was feeling homesick, culture shock, and experience discrimination as leading stressors among students. Significant sociodemographic variables that also, moderated these relationships was age, marital status, Chinese language proficiency, friendships with local students, educational level, prior travel experience, and financial support. So this study ultimately showed that there was a positive relationship among acculturative stress. So once, the stress one experienced as a result of having to acculturate, and depression. So, so it does show that the experience of acculturation is a stressful experience that does relate to that can relate to depression. So this is a really good article, like when we're thinking about our final projects, to think about what does operationalization look like. So take a peek at this if you want an example of that. And also, this is just an article that shows there is that link among of acculturation, stress, and depression. Okay, so we've talked about acculturation, we've talked about culture, we've talked about, the systems, the oppressive systems that we have in place that, perpetuate disproportionality. So what can we do about this? Let's start talking about taking action. So things for you to think about. What are some cognitive shortcuts that you may have taken that has maybe led to there being the perpetuation of barriers, or that doesn't honor helping people move forward and challenge these status quos? So those are things to think about. Also, what have you done in your research and practice that accounts for culture specificity, inclusion, equity? If we don't actually take steps to do things, then we're kind of complicit and we're part of the problem, right? Because these systems are in place to maintain status quo of inequitable distribution of resources. So we have to actively resist in order to make progress and do better. All right. And then also, I hope you can think about what questions are you grappling with at this moment in time? What are you hoping to make progress for yourself on in your own professional development, with your cultural lens, your awareness, and your humility around these issues? Okay. So one way we can do better is not make generalizations about people in general. So in assuming, so for instance, like in work that I do with LGBT youth, it is not effective for me to say that whatever findings I have with my youth applies to all LGBT youth. I always talk about the limits of knowing that there are different subcultures in that acronym, and how, you know, we need to interpret these findings with a grain of salt. So that way we can really try to honor the individual identities within that acronym and how they differ from each other. For instance, how does a lesbian experience differ from a gay man's experience? How does a cisgender individual's experience differ from a trans or non-binary person's experience? So intersectionality takes it a step further from saying there's individual identities and we can't generalize. What intersectionality highlights is the idea that there are multiple factors in each of our identities. So intersectionality refers to multiple dimensions of disadvantage and can inform how groups with privilege are understood as well. So when we think of, for instance, like we have these factors here, like having limited English language proficiency, a racial or ethnic minority status, being a refugee or having an immigration status, religious affiliation, disability, sexual orientation or gender identity, socioeconomic status. So we have these different bubbles, right? And we can talk all day about how you know, experiences of marginalization lead to disproportionality, but we can't say what the specific experience is of people with specific identities or how different systems are differentially impacted. So, for instance, somebody with a diverse race or ethnic identity may have a different experience of how they experience school from someone with a disability. But then for someone who both has a minority racial or ethnic identity and a disability, there's a unique piece right here that may be impacted because both of these statuses are considered minority statuses or marginalized statuses. So, and then to take it a step further, how does that experience interact when you throw in a low socioeconomic status factor as well? So intersectionality really asks us to pay attention to the individual differences and how they come together with the different factors of our identities. So there's a link right down here that looks at an approachable way of how we can present intersectionality to our students. It's a really cute cartoon. I hope you like it. And I think this whole concept basically challenges us to not just, accept, cultural humility, which we'll talk about as a blanket like statement, but to really know that we have a due diligence of learning about experiences of intersections and how those differentially impact people. Okay, so Cole's article, the 2009 article, has 3 guiding questions when we think about intersectionality that can help us kind of make sense of how to intentionally think about this. So first of all, when we think of, of working with a minority community, the question is, who's included in this category? So if I'm working with LGBT youth or LGBTQ youth, am I predominantly working with youth who have diverse sexual orientations? Are there diverse gender identities represented? Or is it predominantly a youth of a group of questioning youth who haven't quite yet identified, landed on labels or identities yet? So it's important to know who's included in a category of people we're working with and making sense of intersectionality or identities in general. Also, what role does inequality play? So when we go back to this picture and we see these interacting parts, each of these groups, socially constructed groups, have experienced, they experience inequality in different ways, right? So when we have these overlapping parts come together, how do those unique experiences work together to inform an even more unique experience? And also, what are the similarities? How is inequality experienced across identities to kind of, form a sense of connection and belongingness. So these are questions to guide our understanding of intersectionality. I hope you really like this article. It's one of my favorites. Okay, so another step we can take toward doing better with our cultural awareness. So a motto that I like to use, and this comes from my own development and how I've kind of made sense of things. So you can feel free to disagree or also have your own kind of bucket list of how you've made sense of your own, cultural development around cultural awareness and culture specificity. So I like to value the idea of striving for cultural competence and living in a state of cultural humility. Because I don't think we'll ever really achieve cultural competence, right? This is being all knowing of other cultures and communities. So I will never claim to actually know what other people's experiences are that are different from me. Even a fellow, Jewish woman's experience. I don't know her experience because we live different lives. But even more so, I would also not be familiar with Latinx person's experience from low socioeconomic status who predominantly speaks Spanish. It's a worldview that I am not familiar with, but that I should continue to strive to learn about the culture so I can connect over different topics and also, be informed about things like machismo culture. But I will never know this experience fully. And so for me, I think there's an important factor of living in a culturally humble state where you're genuinely curious about people you're learning from and working with and collaborating with. Not where we're, being invasive of their space and energy, but rather than making assumptions, why not ask questions and learn about people and be curious about people? So it also, to me, cultural humility also means that I am going to make mistakes and that I want to, in the name of making progress, that I want to be able to apologize and learn from my mistakes. So this is the idea of cultural competence and cultural humility, the idea of striving for competence, not always working toward it, but knowing that for me, I try to live in a land of being culturally humble. So these are some practices, just like worldviews of making sense of how to approach these topics. So there's a thought on, or this article reviewed cultural humility versus cultural competence. So in this article, Dan Soes says cultural humility is essentially a rebranding of anti-oppressive practices, which may explain why it has not gained a level of attention that cultural competence has garnered in social work. So this article, is in favor, and I wanted to present this because it doesn't necessarily agree with my worldview. And I think it's important to be able to digest different pieces of information and have them challenge what you're hearing and consuming. So this article really talks a lot about how cultural competence is something unique and that we keep having to have goals for ourselves of what to work toward, but cultural humility could be considered a lazy way out and just a repurposing. So I would say that I do agree that accepting a state of cultural humility without working toward competency is not acceptable in my worldview. But I do think that living in a land of where both can compete with each other or work together is really effective. He also brings up this idea of cultural competence, which is the process by which individuals and systems respond respectfully and effectively to people of all cultures that recognizes, affirms, values, and preserves their dignity. So I think this is really important, right? The idea of knowing what does affirmative practice look like for when working with different communities, because we do need to create a space where communities can authentically express themselves. So this is what Dan So is calling for with cultural competence. He also brings up construct fragmentation, which is the practice of ascribing meaning and interpretations to concepts that are different from their original definition. So it's important that we think of when we're learning terms and making sense of situations, especially when they originate from cultures other than our own. We really try to honor the perspective that's being conveyed and represented. So that way we're not putting our own meaning on it and trying to rebrand it in a more mainstream kind of way. So things to think about. Also, construct fragmentation. It's that social construction that we can give whatever meaning we want to words, but hopefully when we do offer a sense of socialization via our word choices and narratives we choose to construct, we are building a narrative that is kind and progressive and trying to get away from one that just continues to instill power dynamics. All right, lastly, he talks about oppression exists even in institutions espousing anti-oppressive ideals. So I think this is where we do get in trouble, and where I do a lot of self-reflection is, I think, for instance, when people talk about being anti-racist, I wonder, what does that mean? Do we actively think about what that term entails and what it looks like to walk the walk, rather than just use the words to share, that someone is deemed an anti-racist? So, so I think, in my opinion, I think we need to be intentional, like ways to get around this. How do we not just espouse these words that like say I'm talking the talk and that makes us look performative? I think what we have to do is be really intentional and reflective and unpack different terms and different experiences that we have. So that way, when we do make choices of how we act, how we respond, how we think of situations, we've critically engaged in a way that we have thoughts on it, and thoughts specifically related to how we can do better and not be a part of the problem. Also, a KIP thought of the day, I do think there are going to inherently be ways that we are continuing to be part of the problems because we haven't uncovered and we're still learning what it means to not be part of the problem. So I think the key here is always questioning, how can we do better? How can we learn more to resist rather than go with the flow? Okay. Regardless of whether or not you agree with my take, I'm curious what cultural competence and cultural humility look like to you. One other thing that I will say, I don't necessarily think it's appropriate to say that, we are being culturally humble. We are being socially just. We are socially just. We are culturally humble. We can't be these things. We can work toward these things. We can work toward being culturally humble. We can work toward being socially just. It's not something that's like a recipe book that we can just cook up and make happen. In my opinion, it's a lifelong learning process, right? That we're traveling on and taking a journey, and where we continue to learn how we can do better every day. Anyway, all right. So think about this for you, or any other things that you want to reflect on from this lecture. All right, so a couple other practices that we can do, shifting from an etic perspective to an emic perspective. Etic is the idea of valuing universal truths, the idea that, well, we all want individualism. We all want, free ice cream on Tuesdays. What if someone's lactose intolerant? They're not going to want free ice cream on Tuesdays. So switching from an etic perspective toward an emic perspective, where we value that every person in every culture has its unique value that they bring to the table. And so we want to, get really in touch at a more individualistic perspective rather than at a group, one size fits all model. So this is worth thinking about. And then lastly, I just wanted to share this approach. This is the participatory culture-specific intervention model approach from the book School-Based Mental Health Services. This is the approach that I use in my own research and developing programming for working with culture specific communities. So I think it's 10 steps, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 steps. Um, and really, what it does is, I know in our class, we're developing interventions and programs based on literature reviews and based on what we're making sense of is best for a community. But in a best practice, like reality, ideally what's happening is, yes, you're consulting the literature, but you're also partnering with community members to say, you're an expert in your lived experience and I'm an expert in, therapeutic techniques. What if we could combine, like, I'd love to learn like what your wishes, hopes, and aspirations are for your community and yourself. And we can see if there's like any arsenal skills in my arsenal that could possibly be a good fit. And maybe we can co-develop a program together. So that way, the program that you're developing really is in touch with the community's wants and wishes, rather than, me packaging something for a community when I'm not even a member of the community. Um, so I just wanted to give you a little overview of what this looks like and the idea of really valuing equal partnership, and the expertise that people from culture specific rich communities bring to the table. I hope this can also translate to your work in the schools or in your therapeutic care. So that's it in a nutshell. I hope you get a little something out of today's lecture. Hope you have some thought bubbles and thought nuggets to take with you. And thanks for stopping in, and I hope you have a great day. All right. Happy learning.